At the age of 37, this is what Carrie's day consists of.
Hat with a T.
Her wife Lisa tries to help her remember simple words.
I'm in a lot of pain, and the room is spinning. I feel drunk and hungover at the same time without the good night before. Today is a good day though, so I'm happy.
Elhers Danlos Syndrome makes the connective tissue between Carrie's joints weak. One complication is that it's left her spine unstable and caused symptoms similar to dementia.
Alone, helpless. All she can do really is lay there, and I keep reminding her day in, day out what she's done in life because she's had such an extraordinary life and she can't remember.
They're fundraising for surgery to fuse the bones in her neck. At a cost of £100,000, the operation will stabilise the joints supporting her skull. They hope this will help stop the damage being caused to her brain and spinal cord.
It's been the hardest thing I've ever had to do. Raising this much money. Asking strangers for money. It's not right that we have been put in this position simply because of lack of understanding of my condition.
As a result, they say they've lost faith in the NHS. The health service says it does fund the surgery when the benefits to the patient outweigh the risks. But in Carrie's case, surgeons told her she wasn't clinically eligible for the operation they're now fundraising for in Spain.
The people who've been over, and we know lots of people who've been over, the transformation's been remarkable after the surgery. If it wasn't effective, how do you explain that when someone's went from being bedridden for 5 years to up and about again?
Carrie and Lisa still have the option to apply for special case funding, but they've chosen not to. They don't feel it would be successful and say it would take too long. Dr. David Miller is a neuropsychologist. He's not a surgeon, but he's helped to assess Carrie. He wants to see more research into the condition.
It's the nature of the NHS that they rely on research and systematic research to be able to base their treatments, and that research there isn't there at the moment, so that really is something that they should be pushing for, to go through the illness and also to have to fundraise during that difficult period as well. You can only imagine how difficult that is, and it's something that people shouldn't have to go through.
A charity which supports people with the condition in the UK say they don't know of anyone who's had the type of surgery Carrie needs on the NHS.
The main thing I'd like to do with Carrie is sit and, well, it sounds quite simple, but be able to get her around the house, get her into the garden, be able to sit with her, look through our wedding books, and either for her to remember them or for me to be able to rebuild the memories in her mind. She potentially could get some of it back, but the more damage is done to the brain, the less likely that is.
For now, Carrie and Lisa say they'll keep on fighting. For them and for other families.